Hi there and welcome from ASCO 2017. I'm Maria Whitman. I'm the head of Oncology and Specialty Therapeutics at ZS Associates, and I'm so excited to be joined today by Dr. Yousuf Zafar, who is the Associate Professor of Medicine and Public Policy at Duke University. Dr. Zafar, thank you so much for joining me today.
It's my pleasure.
You know, you are an advocate for improving patient care delivery in a lot of the work you do, and so we're going to talk today about real-world evidence. You know, already at this conference we've heard from the FDA, from payers, from manufacturers, even from patient organizations themselves about real-world evidence. So let's just start with the definition. How do you define real-world evidence?
So when I think about real-world evidence, I think about collecting data from patients and from health systems in a way that is representative of the environment in which those patients were treated. We can collect data from every patient who walks through our doors and who gets treated around the country. We get a incredibly rich and diverse data set where if I think about how I can use that data to make a treatment decision, when I go to a clinical trial, for example, I say, well, how do I treat a patient with stage 4 colorectal cancer? Going to a very large, very detailed real-world evidence data set, I could say, how do I treat my 50-year-old patient with colorectal cancer who also has severe diabetes and plays a piano?
Right.
And I can then tailor my evidence to understand, well, that patient probably doesn't want to get neuropathy. And so I see how do the patients do who don't get the drug that induces neuropathy, who may be a little bit younger than the average age, and who might have other comorbidities. And that's the power of real-world evidence.
It is the power of real-world evidence. Now, as we think about improving the quality of evidence, especially on behalf of patients, one thing the industry's been trying to do is get to better quality of life measures and better patient-reported outcomes, as you've reflected on. Is real-world evidence part of that solution, and how do we get to a point where we can collect more of those metrics, since it does place a burden on the practices then that are collecting this information?
Sure. Yeah, I absolutely believe that real-world data is a part of the movement towards patient-reported outcomes, for example. What we're going to see at ASCO this year is evidence showing that when we collect patient-reported data on patients, their survival is better. And I'm not sure we can get a better outcome than improvement in overall survival because we're collecting real-world data directly from our patients. So this move towards patient-reported outcomes in oncology, I think, is critical to better understand how to design drugs, to better understand where to target those drugs, and to understand then how our patients respond to those treatments.